Bono Regional 2022 Health Review in Sunyani was under the theme Increasing Access to Responsive Clinical and Public Health Emergencies through the implementation of the Network of Practice concept. The region's performance was pegged at 4 out of 5 after the holistic assessment by the Eastern region, signifying highly performing, but with the edge to put in more effort to sustain the gains in the reduction of avoidable maternal mortality, among others. In his address, the Regional Health Director, Dr. Kofi Amo-Kodieh, explained the measures that resulted in the gains.
Institutional maternal mortality ratio also reduced from 84 per 100,000 live births to 75 per 100,000 live births. And this was as a follow-up of the audit recommendations that were done on all maternal deaths, and also the triaging implementation package training that was had in this region. And I'm glad to say that the region topped the national OTIP performance when the regional hospital was adjudged first nationwide, and the municipal hospital was adjudged second nationwide.
He, however, urged the government to decouple proceeds of the national health insurance from the general national payers to ensure the timely discharge of their fundamental healthcare duties.
All these probably could have been well surpassed if we hadn't had a situation where the national health insurance, being the only insurance that actually sustains the facilities, and also being a prong on which Ghana hopes to achieve the universal health coverage in 2030, has become a little of a challenge to us. We urge the government to decouple the health insurance from the general national payers, as was done at the onset of the national health insurance scheme. This, we know, will allow the health insurance to perform its fundamental duty of reimbursing services rendered by the facilities timely and adequately.
Deputy General Director of the Ghana Health Services, Dr. Anthony Adofo-Fosu, used the occasion to appeal to stakeholders to support the service to deal with the challenges of staff refusing postings to less endowed communities.
That we are losing our skilled staff once again as they leave for greener pastures. And we have poor uptake of postings when our staff are posted to less endowed areas. We understand the situation they face: accommodation for staff, schools for children of staff. All these do not lie in our purview as a health sector, but they are important for the deployment of staff to a lot of the deprived areas. So I'm using this opportunity to appeal to the office of the Honorable Regional Minister, the Honorable District Chief Executive, and the Honorable Members of Parliament, our traditional leaders, Nananum, and our clergy, all of society, to come together to help us address the social, environmental, and the economic determinants of health, so that any gains that we make from health service delivery shall be meaningful.
Precious Semevo, Joy News, Sunyani.